Lisa Vassal spent much of her life feeling, well, lousy.
A lot of bloating, had headaches all the time.
About 10 years ago, her sister was diagnosed with celiac disease, a genetic disorder in which part of the small intestine becomes inflamed as a result of eating gluten, a protein found in wheat, rye, and other grains. That got Lisa thinking about her own symptoms.
So when she was diagnosed, I thought, well, that's got to be what I have. So I talked to my doctor and she did a blood test. And when it came back positive, it was relieving to finally have an answer.
An increasing number of people are getting that same answer. Dr. John Garber co-directs the Adult Celiac Disease Program at Boston's Massachusetts General Hospital. He says the number of patients diagnosed with celiac disease is soaring.
The fact that we're seeing this dramatic increase in the incidence of this disease really indicates that we're sort of in the middle of a slow kind of simmering epidemic.
Celiac disease differs from simple gluten intolerance. It's classified as an autoimmune disorder in which the body attacks and damages part of the small intestine called the duodenum when gluten is ingested.
So the typical segment where celiac disease will show up is probably in the first 10 or 15 inches of the small intestines.
Garber says the disease causes a flattening out of the intestinal lining, which leads to poor absorption of nutrients and some common symptoms. They include abdominal pain, diarrhea, constipation, and fatigue. Celiac disease is diagnosed using a couple of tests.
Two things are required for the diagnosis. One is you have to have a positive blood test, and the second part is you have to have a biopsy that shows those characteristic changes in the duodenum.
As for treatment, simple but not necessarily easy. Cut gluten from the diet. It worked for Lisa Vassal. 2 weeks after modifying her diet, she felt much better.
And it's an inflammatory antibody that happens in your body. And I know
In fact, Vassal, a nurse practitioner, now counsels patients who are dealing with celiac and milder forms of gluten intolerance.
it's just food. You don't have to take a bunch of pills. You don't have to have surgery. And it completely changed my life.
In Hopkinton, Massachusetts, Jim Morelli for CNN.